we are watching the latest coronavirus developments and getting insight from Boston's experts. Joining us now is Dr. Robin Colgrove, an infectious disease specialist at Mount Auburn Hospital. Thanks for being with us.
My pleasure.
So Dr. Birx from the White House Coronavirus Task Force now says this pandemic, these are her words, extraordinarily widespread. Given that, what is the risk in Massachusetts now, especially since we're in vacation season?
Yeah, it depends. So the overall testing positive rate in Massachusetts is about 2%, whereas for some places in the South, it's now over 10%. So if you're out taking a walk along the Charles, the risk to you is pretty low. But if you are in an unsupervised party of 90 people jammed together without masks on, the risk is substantial. So it's not so much where things are, but what you're doing that matters at this point.
It's an important distinction. And we have seen the number of new cases continue to increase, as you mentioned, well below levels that we're seeing in states with outbreaks. Yesterday, the president of the Mass Medical Society tweeted that phase 3 is either too liberal or people aren't doing what they should. What do you think?
Yeah, I think the word people is too general here. I think most people, if you walk around, are doing the right thing. The problem is, just like it only takes a few percent of people driving badly to jam up traffic, it only takes a small fraction of people behaving irresponsibly in a public health sense to spread this epidemic. We know now that a substantial fraction of spread is happening from so-called super spreaders spreading to many people. And often these are places where people are not behaving in the way that we know that we should.
And so then we shift to testing then next. So Governor Baker's increased the number of free testing locations throughout the state. The results, though, they can take hours, if not days, to get them back. Do you think it's possible that the virus is more widespread than the current data is telling us?
The virus is certainly more widespread than the current data show. We just can't get to everybody. The best we can do is to estimate from the numbers we're seeing, just the way you estimate from a population sample if you do a poll, what the population in general is. But we know that there are more people out there than we're finding.
So then given that, given delays in testing, that we know there are more people out there, if someone has mild symptoms, they may have had contact with someone who's positive, is it better to just quarantine for 2 weeks, to wait it out, rather than wait to get the test back?
Better in a public health sense, it's always better to stay home when you're sick. We were saying that long before COVID-19, and we wish we could get that message out. So if you don't know the answer, certainly it's better to stay away, right, or to not put other people at risk, both by wearing masks, staying home, staying distance from people, even if you don't have a diagnosis.
All right, still so much to think about with this. Dr. Colgrove, thank you for your time, your insight. We appreciate it.
My pleasure.